Okay, hey everybody. My name is Susan Anderson. I'm an instructor here at CanScribe, and I'd really like to welcome you to the webinar today. Thank you all for attending. Today, I'm going to be testing your knowledge on what you have learned so far in the course. The questions are pretty random, I will admit. So I'm going to be asking you questions in the form of multiple choice, and I would love it if everyone would please put their answers in the chat box. I'm not going to be keeping score, but you guys can keep up with your own score and see how well you do. And then I will give everybody a chance to answer, and then I will be showing the answers and kind of explaining the answers. So I'm not sure about the timing of this webinar, how much time we'll have, but so hold your questions until the end. And if we run out of time, if you need further clarification on any of the questions, you can always email me at sanderson, for Susan Anderson, at canscribe.com. All right, well, let's get started. So everybody, the first question is, pick the correctly formatted answer. Okay, the patient has a 6 millimeter with a hyphen total scabbed area, and or B, without the hyphen. So everybody put your answers in the chat box, what you think it is. Doesn't matter if you're right or wrong. Nobody's keeping score with anything. Okay, I'm seeing some coming in. Good, good, good. Okay, all right, and the answer is, well, that was unanimous. It's B. We don't hyphenate metric terms. And those terms include milliliters, centimeters, liters, and so on, even if it comes before a noun. So, hey, good job, everybody. That was really good. Okay. So what about this? Which is transcribed correctly? Temperature is 36.0. Would you add the 0 or would you leave off the 0? Wow, you guys are all in agreement today. Okay, and the answer is, it's A. So we do transcribe, if dictated, trailing zeros for lab values and for vital signs, but we do not for medications, because it's easy to make an error if a decimal point is misplaced for a medication. So, excuse me, I apologize. Well, Angela, that's okay. We're all here to learn. And so, you know, labs need to be specific, and sometimes dictators won't, the doctors want the labs to be so specific. They'll say, you know, 13.0, and so add it for sure if it's dictated. If it's not dictated, do not add it. Okay. This is a source of great confusion among many students, and many students actually get to the practicum and still have difficulty understanding this concept. So I'm going to give everybody a minute. Okay, all right, all right. And the answer is good. Y'all are right on it today. Follow up 2 words. Will and to actually usually come before the verb follow up. And follow is the verb, and the adverb is up. So it would be 2 words. And you guys seem to have this, but many students use that rule. If you can substitute the word eat, then, and it fits, like in this instance, I will have the patient eat with me, and it makes sense, then it's going to be 2 words. Otherwise, it'll be 1 word. So nice job, everybody. Okay, workup follows the same pattern as follow-up. And so what do you guys think about that? Okay, we have a little bit of some differences here. Okay. Let's see. It's going to be a noun. It's going to be acceptable only as one word. And again, you can, I'm going to, okay. Again, you can use the word eat in this one. Sorry, let me go back. You know, it's just, so it doesn't work in this instance, and so it would be one word only. Okay. So think about it as a comes before an article, comes before a noun, prepositions come before nouns, and so this patient had a lab workup. A something is going to follow. It's going to be a noun, and it's going to be one word. Okay? All right, how about this one? Dictated, blood pH was within normal limits, CO2 24. Okay, and what does everybody think the answer is going to be? Take your time. Lydia, I feel you. Okay, and the answer is B. pH is always formatted with a lowercase p, and you want to add, even though it's verbatim that they did not add the word of between CO2 and 24, you always want to add a small word between two adjacent letters to avoid confusion and for clarity. The better choice of the word to add is of. If you add is, it changes it to a sentence, and that makes it, the formatting would be different. So word of between you know, two numbers like this is the best choice, and this way it's more clear and easier to see. All right, we're moving on. The patient was given amoxicillin 500 milligrams Q6 hours. How would that be formatted? Okay, everybody? And it is D. There's no space between, okay, so Q is an abbreviation by itself. If a word follows it, like Q day, Q week, Q month, there's a space. If it's just a number, then it's Q period and whatever the number is without a space. And because the hours, word hours was dictated, then you would transcribe hours. Now, many times they'll say Q4H. If they do that, then you would have put the H hyphenated, and it wouldn't have been spelled out for hours. So remember verbatim, and a good reference is the Book of Style 13.2.4 dosage schedules. That has a lot of good information there. But remember, try to be verbatim also. We have to follow the account specifics. Okay. How about this one? The patient was told to take a multivitamin Q day. So what is the correct way to transcribe that? A or B? Okay, I'm seeing some mixed results here. Okay. Okay. It is that everybody? A. Q day is a valid term, and again, you see there's a space between it. It's QD that is the dangerous abbreviation and has to be changed. You will see Q daily, Q month, Q year. So Q day, just remember, Q period space and the word that follows is perfectly fine. QD is the dangerous abbreviation. Okay, you guys are doing really well today. All right. A report is dictated with the closing, sincerely yours, but no opening. Would you add the opening or transcribe verbatim without the opening? Okay. I think everybody's in agreement with this one. Good. Oh, sorry, Kim. Didn't quite give you that. Yes, you add the opening. The closing will alert you that this is a letter, and so the account specifics say to add the closing if the salutation is dictated, and it goes the same way. That was great. You guys rocked that one. Okay. Another source of confusion for students is compound modifiers. And so choose the correct one. Well developed with a hyphen or well developed without the hyphen. All right, you guys are on it today. Right, because this is combined to describe the noun that follows. It's not just a well female or just a developed female, but it's a well-developed female. Really good, you guys. Okay, how about this one? The patient is well-developed. Hyphen or no hyphen? Okay. Okay. B, no hyphen. There's no noun that follows, so it does not have to be hyphenated. It no longer works as a compound modifier. And more information can be found about this at Book of Style 6.5.2. Okay. What about the suture, the ovicral? And the dictator says ovicral. How would that be transcribed? With the letter and a hyphen or with a number and a hyphen? Okay, we've got a mixed bag this time. Okay. I think that's it. Everybody? And the answer is C, no hyphen. It's not a compound modifier. It is with the number, and you'll hear it, though, over and over and over. They will say ovicral. It sounds like the number, the letter, but it is the number for sure. And another really good resource is 10.3.12, and it talks about sutures, catheters, needles, and wires, and that's a really good one to look over. But it's not used, even if the noun follows, it's not a compound modifier. It's giving the size of the suture. That's all. Okay. All right, how about this one? A timeout was taken in order to identify the patient. A or B? Okay. I like that, a question mark. Okay, this follows the same pattern as follow-up and workup and setup and timeout, step down, all of them. One word if it's a noun or an adjective, two words if it's a verb. You would say something like, a test will time out after 48 hours. That would be two words. That would be used as a verb, and it would be two words. Okay, so many words, you guys, once you realize this pattern, you will see that there's just a ton of words. There's lots of words that fit this same pattern. Okay, is this sentence correct or incorrect? The patient was given lisinopril for hypertension. I told you these were random questions. Okay, all right. It's incorrect. Lisinopril is a generic drug. Right, Andy. Good. Good. Okay, so you always want to make sure, you always want to look up drugs to see if they're generic or name brand. All right, so this is another source of confusion for some students, not everybody. How about specialties, capitalized or not? I referred the patient to A, B, or C. Well, that's why we're going over it, Kasim. That is for sure. I see this a lot. Okay, it is B. If you can replace the specialty with a name, your name, my name, anybody's name, John Smith, then you capitalize it if it fits. I referred the patient to John Smith. So that makes sense. And so you would capitalize that. Just like you would the proper name John Smith, it would be a proper name. It's just substituting for a proper name, basically. We're going to have a few more of these, so hopefully it'll make sense for everybody. How about this one? The patient will see bariatrics in follow-up. A or B? Use the John Smith rule. Good, good. Okay. A, bariatrics. The patient will see John Smith in follow-up, and it fits, so you would capitalize it. Again, it's just taking the place of a proper noun, a proper name. And you can use anybody's name, you know. Use your children, use your husband, your wife, whatever, it doesn't matter. Okay. How about this one? The patient was seen in physical therapy. I'm seeing a lot of... Great, you guys. That's really good. That's really good. Okay. Almost everybody agreed. It was in physical therapy. You cannot be seen in John Smith. So good job on that one. All right. Is this correctly formatted or not? Yes or no? The patient has a 3-centimeter scar across his thigh. You guys are rocking it. Good job. I mean, I think my answer was wrong because it is correctly. Made a mistake. Anyway, the answer is yes. You guys all got that correct. I got it wrong. Metric compound modifiers are not hyphenated. And so it was correctly formatted. Okay, what about this one? I have written a prescription for doxycycline, 100 milligrams, PO, Q4 hours, PRN. Is this correct or incorrect? Or yes or no, is this correct? Okay, I'm seeing some mixed ones. And Lisa is right. It's a generic drug, so it's not formatted correctly. Good job. Okay, here's another one. The patient was seen in follow-up. Is this one word, 2 word? I know. Listen, it's good to go ahead and learn this, though. I'm telling you. Okay. Seeing mostly. Okay, I'm seeing a mixture. Okay, the answer would be 1 word because it's acceptable only as a noun. Okay, in is a preposition, and prepositions come before nouns. So nouns, 1 word. So good job. One more I have. The patient will have a follow-up appointment in a month with Dr. Name. 1 word, hyphenated, or 2 words. Okay? I think that's everybody. And it is acceptable with a hyphen or without the hyphen, but it would be one word. It would be connected. Two words would not fit there. The patient will have an eat, does not work. A eat does not work. So just try to remember that articles come before nouns or an adjective describing a noun. So follow up in this case is describing appointment, and it's being used as an adjective. So good job, everybody. Okay, see this a lot also. ABCARs were 9 at 1 minute and 9 at 5 minutes. Choose the correctly formatted answer. Spelled out or all numbers, A or B. Okay, I'm seeing a definite mixture of these answers. Okay. And it is B at 1 minute, that we use the numbers. So account specifics say to spell out, I have that backwards, I apologize, to use the numbers. And Book of Style says to spell out. And account specifics rule, they trump Book of Style rules. You use the numbers. We use Arabic numerals in our course. So I apologize, you guys. Do not spell out, in other words. Okay. How about this one? Formatting. Dictated date 3/12/2019. Which one is correct? Okay, there's a mixture of them, of answers here. The answer is C. Standalone dates and names under headings do not use periods. Anything else would use a period. Nope. The B has a period after it, and C does not. So if it was a name like surgeon or doctor, like anesthesiologist, and then doctor name, no period, because the rule is standalone dates and names under headings don't use periods, and that is in Book of Style 1.2.6. It happens, Judy Ray. Okay, let's go with this one. Checkup or checkup or checkup. The patient had a checkup appointment previously scheduled with me. Okay. Okay. I think everybody got that right. It's either acceptable with or without the hyphen. It's being used as an adjective there. So I think personally it's easier just to drop the hyphen and use everything, because it's totally acceptable to use just one word. And that way you don't have to worry about, the only thing you have to worry about is if a verb is being used, then you would use two words. Otherwise it'll always be one word. Because if you do use a hyphen for a noun, it's going to be incorrect. So just so you know. But good job. Everybody's doing great. All right. How about this one? I see this a lot. The patient this is dictated. The patient is a 35 years old female. How would you transcribe that? Excuse me. Okay, everybody's in agreement. And sorry, you would drop the S and you would hyphenate it because it's describing the noun that follows. That's really grammatically incorrect to have a plural, 35 years old female. You would have to, in this case, change it to make it grammatically correct. So if you say the patient is 86 years old, for example, down at the bottom here, no hyphen, because there's nothing following. The patient is an 86-year-old male. Of course you would hyphenate that because it's describing male. If it's written as the answer, I mean how it was dictated, if it was dictated like 35 years old female, you would just drop the S and add that. Does that make sense to everybody? Okay, good. All right, what about this one? The patient is 40 years old. How would you transcribe that? Okay, I think everybody's in pretty much agreement with that one. Good. Verbatim. Don't hyphenate if plural and no noun follows. Okay, good job. All right. Choose the correctly transcribed sentence. At one time, this patient had undergone treatment for breast cancer. Okay, I'm seeing some mixed results here. Okay, the answer is, everybody? Is that everybody? A. If one is being used as an adjective, as it is in this case, then you use the number. The only time you spell out one is when it's used as a pronoun. And a good rule of thumb is if a noun follows the word one, then you will not, okay, if the noun follows, then you use the numeral. If there's no noun following, then it's being used as a pronoun, and you would spell it out. Otherwise, you really you don't spell out numerals. You use the numerals in transcription. You know, there are a couple of exceptions to every rule, but this one's a pretty good one. If a noun's following one, use the number. If not, spell it out. Okay, what about this one? I see a lot of contraction errors in reports. So the patient said, I can't stand to eat breakfast. Which one is correctly formatted? I'm seeing a lot of differences. Okay, is that everybody? Okay. You know what? I have my numbers wrong here. Yes, B is correct. Exactly. I can't stand to eat breakfast is a direct quote because I is being used. If it had been the patient said he can't stand to eat breakfast, then that would not have been a quote, and you would have spelled out cannot as per your account specifics. Okay, good, everybody. Okay, all right. How about this one? The patient has a history of Parkinsonism. Which is the correctly formatted sentence? A, B, or C? Okay. I love that you guys are all participating. Thank you so much. I really do love that. Okay, and the answer is A. It was an eponym when it was Parkinson or Parkinson's disease because it was named after somebody, but when the word changes form, it changes case also. This term is in Stedman's, and it is lowercase. You'll see this for a couple of them, like you have Cushing's disease or Cushing disease, and then Cushingoid features. Those are, when it changes form again, make sure to look it up to be sure whether it's capitalized or not. All right. All right. What about this one? The patient was given lactated ringers. Which one is correct? Heather. Okay, is that everybody? Right, you guys? Okay, so again, ringer is a person's name. It's an eponym. So the rule is if the noun follows, do not use the apostrophe S. If they had said the patient was given lactated Ringer's solution, even if they had said Ringer's solution, you would have dropped the apostrophe S and just added the solution is the noun, and it's then being used as an adjective, but you would still keep Ringer capitalized. So if no noun follows the eponym, then you definitely use the apostrophe S. And you will hear dictators add the S all the time, but it's up to you to know that if the noun follows, you do not use the apostrophe S, and this is in your, Angela, this is in your account specifics, but if, I am not sure of the rule, but if you want to send me an email on this, Angela, I will find it for you. Okay, so no noun, add the apostrophe S. Yes, I would. I would leave off the S. Anytime you do a search, leave off the S. But yes, otherwise. All right, let's move on to the next one. The patient had a positive Romberg's. Okay, which is correct here? Okay, is that everybody? Okay, the answer is B. It follows the same pattern. The doctor sounds like he says an S on the end, but it is the name of a person who came up with this test, and it is a test, but you don't add words, and so it would just be a positive Romberg's. Again, no noun follows, then you use the apostrophe S. If there's a noun that follows, if test had been there, you would have dropped the S. Romberg test would have been like it. I don't know why these little rules are what they are, but that's just the way it goes, and we have to follow them. So, all right, one more. Right, rules. The patient had a positive McMurray's test. Now this time the test is following. A, B, or C. Okay. Okay. Everybody, it is C. Again, eponyms, you drop the apostrophe S when there's a noun that follows. Good job, everybody. That was good. All right. Okay. So after seeing Dr. Name, the patient was to see the anesthesiologist in preparation for surgery. Oh, good, Angela. I'm glad. A or B? Lowercase anesthesiologist or uppercase B? I'm kind of seeing a mixture here, mostly A's. Okay, and the answer is A. It's a generic term. It could be any anesthesiologist in the country. So specialists are not capitalized unless they're part of a named facility. And in that case, it would probably be plural. The patient will see scrubbed information anesthesiologist. They're just scrubbing the name there, like North Carolina anesthesiologist. I don't think it would be singular capitalized like that. But there may be an exception to the rule, I'll just say. But anyway, otherwise, this John Smith rule doesn't really apply for this, but thank you guys, but just think of it as generic. If it's not scrubbed information in front of it, it's going to be lowercase. Okay. All right. This is totally different, but the patient was given 1/2 of a 5 milligram tablet. How would you transcribe that? A, B, C, or D? Thanks, guys. Seeing a mixture here. Okay. I think that's everybody. The patient was given, uh-oh, I've lost my PowerPoint. Hold on. Hopefully it's going to come back in just a second. Oh, thank goodness. Hold on. Oh, my goodness. Apologize. I don't know what happened there. Okay. And the answer is, honestly, 1/2. So the rule basically is if a fraction is followed by a preposition, of is a preposition. So if it's followed by a preposition, it will be spelled out. 1/2 spelled out of a 5 milligram tablet, or 1/4 of preposition, a tablet. If the noun follows directly, then you use numerals. 1/2 tablet. There's nothing in between that. 1/4 tablet, and you would use the fraction itself. And this is in fractions. You can look up just fractions and read more about that in Book of Style. So just remember that it's all in the wording. I know sometimes students get frustrated because they spell it out one time and they use a fraction one time, but it does depend on how it's written, how it's dictated. Okay. All right. The patient was prescribed hydrochlorothiazide, 12.5 milligrams. How is that written out? A or B? Okay. And it's going to be B. You use decimals for metric measurements, and milligram is a metric measurement, and you use fractions for non-metric. So this would be something that always, if they say 5.5, 2.5, it doesn't matter. You would use 12, or you would use the decimal, and you would not spell out milligrams either. So I mean, that's just, all of y'all knew that. But just remember that. Decimals for metric units of measurement. And that's not just like 1/2 of a pill. This is like when it gives the dosage strength, like the unit of measurement that follows, like milliliters, milligrams, liters, and things like that. Then it's always going to be a decimal. Okay, what about this one? Prescription was given for Protonix to be taken QAM. Which one is correct? Okay, anybody else? Okay. Okay. It's going to be E. A couple of things. Protonix is name brand, which I think most of y'all knew that. But QAM, this is an abbreviation. There is no space between QAM, QPM. It's an abbreviation. It's not a word that follows. It's an abbreviation altogether. So again, if it was Q day, it would be Q space day. If it was Q4, it'd be Q period 4, no space. QAM, though, is just one abbreviation, and it's all together. I see this a lot where Q is space, there's a space after it in, you know, when AM or PM follows it. Okay? All right? Another follow-up. I know you guys are probably sick of it, but I see so many errors in this. I just want to kind of hammer it home. The patient was seen in follow-up. Okay. I need lots of hammer. Okay, good one. Okay. All right, that's good. Everybody got that? That's fantastic. I want to see this in your work, all of y'all. Okay. Acceptable is one word only, no hyphen, because it's a noun. Okay. All right. How about this one? The patient weighed 125 pounds. Which is the correctly formatted answer? Okay. I think everybody got this right. And even if you see this come in as LBS, you need to change it to pounds, because the Book of Style Rule 12.2.1 says don't shorten or abbreviate non-metric terms. Pounds, inches, feet, things like that. Don't shorten or abbreviate those. Good. Everybody got that. Good job. Okay. How about this one? The patient's weight was 125.5 pounds. How about that one? Would it be a decimal or a fraction? Okay, I'm seeing a mixture there. Okay, it's going to be a half. Use decimals for metric, fractions for non-metric measurements. Pounds, inches, feet, all in fractions. In milliliters, millimeters, centimeters, metric, and that would be decimals. Okay? I know you guys. Oh, this is the reference here too. Book of Style 10.3.7. Okay. The patient will receive 10 milligrams POQD. Which is the correctly formatted answer? Wilma, if you have a question about it, just send me an email. Okay. And A. The patient will receive 10 milligrams PO daily. Daily is the correct expansion for QD. You don't need to expand QDay, but QD you expand to daily. And it's a dangerous abbreviation too, you guys. So make sure you are making a note of that. QD, always daily. Okay. The patient has Alzheimer's disease. Which is the correctly formatted answer? Okay, I'm seeing some mixed. I'm seeing mostly one. Okay. D. If no noun follows, don't use the apostrophe S. Disease follows that one, and you'll hear Alzheimer's. It sounds like it has the apostrophe S on it all the time, but you have to delete that and just or not transcribe it. So if disease, yes, all the time. If they just said the patient has Alzheimer's, then that would be apostrophe S because disease or condition doesn't follow it. So that is the rule. Noun follows. There's a lot of rules like that. If the noun follows, it changes things. Okay, so how about this one? This one is dictated, the patient is on no medications and he has no allergies. What is the correct way to format that? Okay. C. You make a new paragraph. You drop the little word and or but, and that is the reason for that is that our account specifics say that you need to start a new paragraph for every major report section, and that includes labs, diagnostic data. If you have a paragraph where they're going over lab data and they say a bunch of blood work and then they start talking about maybe a chest x-ray, start a new paragraph. If they start talking about the chest x-ray and then they say that the patient had a foot x-ray, start a new paragraph. These sections need to stand out so that the reader is able to see it easily. Aw, thanks you guys. I'll mention that. Maybe we can start something. Who knows? Okay, let's go to the next one. The patient received 250.0 milligrams. Thanks, you guys. Which one is correct? Okay. I think almost everybody got that one. And the answer is C. You don't add a trailing zero to medications, even if the zero is dictated. It could be mistaken for 2,500 milligrams. And it's easy to do. That little decimal can get overlooked. And there are a lot of safeguards nowadays with medications, but you still want to be super careful. And the rule is, even if it's dictated, leave it off. Okay, how about this one? The patient is well-developed and well-appearing. Which one is correct in this one? Okay. Micah, I'm going to give you a shout out. The answer is C. She was the one that got it right. The reason being, well-appearing is always hyphenated. Appearing cannot stand on its own. So you can be ill-appearing, odd-appearing, whatever appearing, and it's hyphenated. It doesn't matter whether the noun follows or not. Well-developed would not be hyphenated because the noun doesn't follow. The patient is well-developed. There are other words that can't stand alone either, and I can't think of them right now, but there are a lot of them. So, okay. Right, Angela? I know, all these rules. Okay, choose the correct answer. Dictated, surgeon, doctor name. How would you format that? Okay. All right. B. Put a period at the end of every sentence and every item under a heading, even if just word, except for names and dates. So again, if this was date, we don't add a period, and if it's a name, we don't add a period. I don't make the rules. I'm just going by them. Okay, what about this one? It's dictated EBL 300 cc's. Which one is correct? Okay. All right, I think most everybody got that. Its answer is C. CC, first of all, is a dangerous abbreviation and always has to be changed to milliliters, like ml. And EBL would not be expanded because it's transcribed verbatim. And it's okay to start a number under a heading or a subheading if it's not written in sentence format. Lots to go over in that one. Okay, how about this one? Her symptoms were short-lived. A or B? All right. I think everybody's getting this one. Good. It's A. Lived can't stand on its own when used as an adjective. So that's good. Doesn't matter whether the noun follows on that one or not. Good job, you guys. Okay. How about this one? Chief complaint is headache. A or B? Okay. Is that everybody? B. Is makes it a sentence because is a verb. And so if it's written, if it's dictated as a sentence, just make it a sentence. If it's dictated as chief complaint, headache, then you would make that into a heading. Your account specifics talks about this. There is an exception, as you guys know, for the diagnosis section, but if this is just written as a sentence, just leave it as a sentence. Just transcribe it as a sentence. All right, let's go over this one. Preoperative diagnosis is umbilical hernia. A or B? Okay, that is the exception to the rule. If it's a diagnosis, impression, or assessment, it doesn't matter how it's dictated, whether it's a sentence or not with a verb, you always make a heading. And the reason for that is that it needs to stand out. The reader needs to be able to see it, and that's in our account specifics also. So everything else, if it's a sentence, transcribe it as a sentence. But if it's a diagnosis, impression, or any assessment, any diagnosis like final, initial, preoperative, postoperative, any of that, discharge diagnosis, anything, all of those, if it doesn't matter how it's written, it needs to be a heading. And that's also in your account specifics. Okay, one more follow-up. I will see the patient after his follow-up with Dr. Name. 1 or 2 words, or with a hyphen. Okay, it's 1 word, noun. It's acceptable only as 1 word. I will see the patient after his eat with Dr. Name. That does not work. Try to use that rule, guys. It works for most of the situations. This is a noun and acceptable only as 1 word. Okay, how about a little formatting for the physical exam? On exam, the patient is well appearing in no acute distress, HENT, normocephalic, and atraumatic. The rest of the physical exam is normal. A or B? Okay, I'm seeing definitely some mixed answers here. Okay, it's A, stacked. So our account specifics say that even basically if 1 subheading is used, you have to stack the physical exam. So HENT, normocephalic, and atraumatic, there is no verb in between there, and you have to make that a subheading. I mean, yes, a subheading. I can't talk today. And so that would be, you would stack it. And the vital signs go on a different line than the general information. So if it says the patient is well appearing, blood pressure, and you're going to stack it, put everything on separate lines. Not all of the vital signs would go all on 1 line, but you know what I'm saying. Okay. How about this one? The area of the wound measured 3 by 5 centimeters. Which one's correct? Okay, good job, everybody. C, there's spaces between the numbers and the X. Good job. Okay, how about this one? Concerning times. The patient was given the antibiotics to be taken times 7 days. A, B, or C? Okay, good. I think everybody got that one. A, the rule is the number comes before times, use the X. Number comes after the times, spell it out. So dictated times 1, it would be X times X1, and dictated 1 time, it would be 1 time. I think everybody got that right. Good job. How about this one? The patient had a 3-inch gash across his forearm. Correct or incorrect with the hyphen? Okay, I'm seeing some mixed ones here. Think about it. Is this a metric term or a non-metric term? And the answer is A. It's a non-metric term, and it's hyphenated when used as a compound modifier. If this was 3 centimeters, it was 1. Yes, Chelsea, for sure. We're running out of time, so I'm kind of going a little bit quicker, trying to quickly finish up here. Okay, how about this one? You're welcome. The patient will see neurology or capital neurology in a few weeks. Use the John Smith rule, and it would be capitalized. Good job. Good job, you guys. About this one, the patient was seen at the dermatology clinic next week. Which one would be correct in that one? Okay, dermatology clinic, not named, no scrubbed information in front of it, so it would be generic and lowercase. Calcium, it will be on the webinar. It will be posted. The webinar will be posted on the forum for y'all to review. I don't have a handout, but it will be on the forum for you guys to review if you want to. Okay. One last one about follow-up. Follow-up in March. Which one is correct? This is kind of a trick question because this is one of those rare instances where it would be either a verb or exactly, calcium can be both, or a noun. Think about the noun as an appointment in March, or go ahead and have an action to follow up in March. The hyphenated version would not be correct here because it could not be used as an adjective. Okay, how about this one? The patient received a prescription for 50 milligrams by mouth TID Q daily. Bye, Indy. Thank you. Thanks for coming. We just have a couple more here. Okay, and the answer is C. You transcribe verbatim. You don't shorten or abbreviate terms. And Q daily is okay if dictated as Q daily. And again, there's a space between those. You don't shorten by mouth for PO. And there's a space between Q and daily. And that QD, remember, is the one that you need to change. QD and QHS. I will see the patient in 6 to 8 weeks. Which one is correct? Okay, and it would be A. You use a hyphen to denote the word to when used in ranges. There are some exceptions, and we're going to quickly go over them. The patient will be seen between 4 and 6 weeks. What do you guys think about that? Okay, good. I'm mostly seeing A. And you do not use a hyphen when the phrase between and are used. And that's in Book of Style 6.5.7. You guys, there's a good list for that. The patient was prescribed Benicar HCT. Which is correct? Okay, and it's actually A. This is a name brand drug, and that HCT is actually part of the name brand. There are a couple of them that fit this pattern, so always look up your drugs to make sure. If it was something and then HCTZ, every single time you would spell that out. But if it's a name brand and it includes HCT, you leave it as that. Okay, we've got two more, I think. Okay, correct or incorrect? The patient was given a prescription for 100 milligrams, 150 milligrams of Synthroid. Okay, this is kind of a trick question to you guys. I'm sorry. Lots of times dictators will say Synthroid and levothyroxine, they both come in milligrams and micrograms. So the dictator will lots of times say the incorrect thing. But if the dosage is less than 1, it's a milligram. If it's more than 1, it's microgram. So 150 would be micrograms. This is something you need to be aware of. Synthroid, levothyroxine, flag if you're unsure. Once you start working, you can change it on your own because you know it's correct. But for now, flag it if you're unsure. But doctors frequently get this one wrong. Two more. The patient had 40 to 50% stenosis of the carotid artery. Which is correct? Okay, we're running out of time, and the answer is C, actually, you guys, because, again, read over Book of Style 6.5.7. It gives you a list of when you can use a hyphen and when you can't, and if symbols are involved, you cannot use the hyphen. How about this one? Hemoglobin range from 13.1 to 14.5. How about this? Which one is correct? I think everybody's got it. That's right. You can't do it when the decimals are used either. If you can look back at this one and see that A is so confusing by all those numbers and the decimals and the hyphen, it's for clarity. All right, you guys, great job. And I really appreciate everybody's participation. Y'all have been wonderful, and I appreciate your time. Thank you for joining me. Thanks for coming. Thank you, guys. You're welcome. Thank you guys so much. Lydia, I'll make note of this, okay? Thank you. Aw, great. Thank you, Wilma. You're welcome. You're welcome, guys. Y'all have a great afternoon. Thanks, Calcium. Thank you, guys. You're welcome. I really appreciate you guys coming and participating.